Hello everybody, and thank you all for attending this session about our research, patient preference with regard to negative pressure wound therapy and participation in wound care, a qualitative study. My name is Alexandra Janssen and I work as a clinical nurse specialist in the Elkerliek hospital, which is in the Netherlands, in the south of the Netherlands. I have no disclosures. As we all know, negative pressure wound therapy is a very popular therapy since the 90s, as it increases the blood flow, it increases the granulation tissue formation, and it decreases the bacterial count. And each day worldwide there are several thousand applications of this therapy. But what we also should be aware of is that there is an impact of the wound and the treatment, and especially the negative pressure wound therapy, on the quality of life of patients, on the different domains of the quality of life of patients, the physical domain, the social domain, the religious domain, economical domain, and the psychological domain. And we should be very aware of this. So not only by the treatment, but by the wound, but also by the treatment. And we saw that in our hospital that there were quite a lot of patients who deceased, who premature terminated their therapy, their negative pressure wound therapy, before the goal was reached. So we looked retrospectively at the patients with infected abdominal wounds, and we found 84 patients treated with negative pressure therapy because of their infected abdominal wounds, and more than 1/3 of these patients premature terminated this therapy because of different reasons, but more than half of these patients because they were tired of the therapy, they really wanted to stop it themselves, so they indicated the wish to stop this therapy themselves. So after that, we did a quantitative systematic review on negative pressure wound therapy versus standard wound care, on the effect of this on their quality of life. So a systematic review, and we found that specifically in the first week, there was a lower quality of life of patients treated with negative pressure wound therapy. And after that, this difference vanished, and at the end of the therapy both quality of life scores were quite similar. After this, we did a qualitative systematic review to find out what this negative experiences of negative pressure wound therapy comprises. So we were able to identify 4 themes in this qualitative systematic review. And the first theme is a reduced freedom of movement caused by an electric device. So patients are attached to this device, resulting in physical limitations. They indicated they are faced with an unknown and quite impressive device which constantly reminded them of having a wound, and the physical restrictions of being attached to this tube, which is attached to the pump, was mentioned several times, because they had to make extra efforts not to trip over the tube, not forget their device when going to the bathroom. But it also had some psychological consequences, because this pump could alarm during inappropriate times during day and night, leading to anxiety, because patients experience these alarms as a treatment both for their safety but also for the effectiveness of the therapy. And also they felt ashamed because they were so obviously in treatment. You see the fluid running through the tube, and yeah, they thought it wouldn't look that nice. Some patients prefer to stay at home so that people couldn't see their device and this fluid running through the tube, and radically reduce their social interactions. So the second theme on this qualitative research was the decreased self-esteem, because they reported a clear psychological effect of having a wound, but also this pump constantly reminded them of their wound. So they live with a device that constantly makes them aware of having this ugly wound, and the pain and the smell, which give them an unpleasant feeling of their self. They feel unattractive and had an altered sense of themselves. And the third theme is increased social and professional dependency, because they needed help from family and friends, and they needed help from healthcare professionals. The support for from their family and their friends was mentioned as very important, both psychological and practical, because they needed the motivations to hold on and to keep on going, but they also needed the help for getting in and out of their clothes and doing grocery and that sort of stuff. And professional assistance was considered a requisite from caregivers who are familiar with the working principles of this therapy, because they wanted to be treated by healthcare professionals who know what this therapy is about, but also what the impact on their lives meant to them. And the fourth theme is gaining self-control. When in time, when patients understood what the therapy is doing and saw that it worked, they tolerate the negative pressure wound therapy better, and they become more responsible of the situation and how to respond to alarms, and learning how to handle the pump. And they at this point, patients may have experienced negative pressure therapy as a new and positive and active therapy, and a positive professional relationship with the caregiver combined with family support help patients to accept negative pressure wound therapy better. So after that, we did interviews with 10 patients treated with negative pressure wound therapy, because we wanted to know what living with a wound and living with this therapy meant to them. And also here we were able to identify 4 themes, and that will not be a surprise, is that having a wound influences the quality of life in a huge way. Worrying about the future, about whether the wound would heal, whether they would be able to live their normal lives again. That was the biggest concern of most of the patients. Anxiety and sadness and dreariness were mentioned, and they were the predominant emotions mentioned. And the second theme was that negative pressure wound therapy influences the daily life of patients in a very big way. The weight of the device, the noises that accompanied this treatment, difficulties with dressing, the short tube length, and other patients the long tube length, and all the themes that were mentioned in the systematic review were mentioned again in this interview sessions. Surprisingly, the third theme is that the professional treatment decisions were considered as most important. We really want to make a shared decision of therapy, but the patients mentioned that They wanted to be well informed. They wanted to be thoroughly informed about the different treatment options. What is one therapy? What is the other therapy? What are the pros and cons of standard wound care? What are the pros and cons of negative pressure wound therapy? And then they say, well, you're the professional, you're the expert, you make the decision for me, for my treatment, which is quite controversial to the principles of shared decision making, where you indeed want to thoroughly inform the patients, but then make together, or the patients make the treatment decision. So they all plan, they didn't want to make the treatment decision. They wanted to make to let the healthcare professional make the treatment decision. And we also asked if they were willing to treat the wound themselves, and they all mentioned that they would want to do it when the wound was healing, at the end of the wound healing process. So at first, when the wound needs debridement, they say, well, we can't do that as good as the wound care nurses, and we are afraid that this would influence the wound healing process. So they say, well, we can treat our wound at the end of the therapy when we see that it's healing, and with the supervision of well-trained wound care nurses. So when you say that maybe for some patients negative pressure wound therapy isn't the best choice of treatment, then you must have an alternative. And we also did research on a potential alternative, the rapid capillary action dressing, which is a 3-layer structure of polyester and polyester cotton filaments, and it works as a pump through capillary action, because before production this dressing is 18 centimeters thick, and then they compress it to 3 millimeters, and then they lock it, and it wants to go back to its original size, original thick layer, but it can't, and then it creates a continuous capillary action because it has thin canals. It sucks the fluid into the dressing and through it into the absorbent dressing. And we did some case studies, 10 case studies on this rapid capillary action dressing, and these were all patients who were first treated with negative pressure wound therapy, and all these 10 patients indicated a wish to stop this therapy because of different reasons, and then they switched to the rapid capillary action dressing. And here you see two of these patients, a 76-year-old man with a post-operative wound infection at his left knee, below his left knee, and you see a good healing. The first picture is at start of negative pressure wound therapy. Then the second picture is the picture where the switch is made from negative pressure wound therapy to the rapid capillary action dressing, and the last is the healed picture, or the picture when we stopped the rapid capillary action dressing. Below the same, and this was a 17-year-old man with a right forefoot amputation, and at right you see that the granulation tissue has reached skin level, a little hypergranulation, and then we stopped and switched to another therapy. So I think more research is needed, but this seems quite a promising alternative to the rapid capillary action dressing, and we are planning to do a big retrospective study first, comparing negative pressure wound therapy with this rapid capillary action dressing, and also a prospective study, but that will be later. So to conclude, we can say that there is a huge impact of wounds, but also on the treatment on the quality of life of patients. And patients want to be really well informed about the pros and cons of different treatment options. They want to know that there are options, different options. But then I think as healthcare professionals, we must really invite the patients to share their preferences, share their abilities, share maybe their experiences with the different treatment options, and then more together when we invite the patients to share these experiences and we talked about the pros and cons of different treatment options, we can come to more shared decision making, decisions of therapy. I thank you all for your kind attention and wish you a very pleasant Congress. Thank you.